Let me pick up from there. I can. That's actually a very nice lead-in, which is not unusual for my good friend from New York, and I see these things in a similar fashion. As I suggested in my opening remarks, I have concerns that your budget is based on financial tax increases and fees and that are unlikely to pass and actually become law. So I think your number is probably a little bit higher than we're going to end up with in this committee. Given that fact, or given that possibility, and again, it could always change if there's a larger deal that involved the president and the congressional leadership, but absent that, what would be, if we had to operate on roughly the same amount of money we had last year, how would you prioritize that? What are the most important things from your perspective that you'd really like to see accomplished?
So, Mr. Chairman, when we put together the budget, as we put together a budget, and I am now a piece of it. I used to be in a seat that brought all the pieces together. But what we've tried to do is make those choices and articulate where we believe the choices should be made. And those are choices that I believe, we all need to discuss. But those are important choices. And one of the reasons that I think they are extremely important choices is it is a cap, but it is sequester. It is a policy that I think many did not expect to be in place. And whether you did or you didn't, I actually think we should put that aside, but actually put through and view it from the lens of what is the actual impact. And when we think about the levels, when you say about the choices and what happens at these lower levels, I think it is important to hearken back to what happened in 13, when we were, for a period of time, at what we would call a sequester level. And let me just give two examples. One is at NIH. During that time at NIH, we had the lowest number of grants that we were doing for project research that we had in a decade's time. In Head Start, 57,000 children lost their Head Start. And so I understand that these are tough choices. I understand why this is not, in terms of the jurisdiction, it goes well beyond this committee to many other committees as well. But I just think we have to, part of what we try to do in our budget is be responsible about saying, and as a percentage of GDP, when you think about our discretionary spending, and we can have the mandatory conversation that the chairman raised, I'm not sure, we want to do that here, but that we do need to recognize in terms of the investments we need to make as a nation. And let's just look at the year in review. When Ebola happened, what were the expectations of the executive branch and the federal government? And whether, with regard to the issue of when the children came, how do we take care of those children in an appropriate fashion in terms of the unaccompanied children? Measles right now. Right now we read in the newspapers the issues of the superbug and the question of, are we, aggressive enough about that? And is the federal government aggressive enough on measles? Those are state responsibilities. So my answer to the question is, we believe that we have put forward what we believe are the right choices. And those choices extend across and beyond committee jurisdiction, and I know that. But those are the choices, and they are tough choices. They are, and we know that some will be disagreed with, just as, the critical access issue we just discussed, or, what I heard from Ranking Member Lowy is, perhaps you didn't put enough in the hospital. And so we have throughout made choices, and in the discretionary, over $750 million worth of cuts.
Well, again, I don't disagree with that, but just for the record, this isn't a policy, it's the law. It's a law that Congress passed. It's a law that the president signed. And again, absent a larger agreement, we'll be living within the law, I suspect. So I think we're going to have to make those choices, and I look forward to working with you as we go forward. Let me quickly move to one other matter, because I can't enforce the 5-minute rule if I don't keep it myself. I know you're familiar with the Weldon Amendment, which has been carried in Labor-HHS bill since fiscal year 2005. The amendment prohibits federal funding prohibits funding to any federal, state, or local government that discriminates against a health plan for refusing to cover abortion. The Obama administration has issued regulations designating the HHS Office of Civil Rights to enforce the Weldon Amendment by receiving complaints and violations. I understand, I've been informed, perhaps misinformed, but informed that the state of California, recipient of funds under the bill, recently began requiring all health plans sold within California to provide coverage for abortion on demand through all 9 months of pregnancy. It's a clear violation of the Weldon Amendment. However, 6 months after the mandate was issued, your Office of Civil Rights has failed to take corrective action. mandate went into place immediately in August of 2014, so real harm is actually occurring now. Complaints have been filed by several entities, including a number of evangelical churches that oppose abortion and are currently being compelled to fund it through their health insurance. So time is the essence. Could you tell us where we stand in this matter and when your Office of Civil Rights Compliance intends to act?
With regard to the implementation of the Weldon Amendment, it is something that we take very seriously, and the complaints came in and we opened the investigation with the Office of Civil Rights. We are moving to do that investigation expeditiously. With regard to my ability to say and tell the Office of Civil Rights when to finish the investigation, that's something we want to let the investigation run its course so we can use its results. And so we are working expeditiously. The Office of Civil Rights knows this is an important issue, as you have said, and that time is of the essence.
So the investigation is underway right
now. It
now.
is, and yes, sir, it is. Right now, we heard from organizations, and when we heard from organizations with regard to the issues that you've raised, we opened an investigation.
Well, thank you very much, Madam Secretary, and we will be following up with you on that to make sure that investigation does get carried through. With that, sorry I ran over a little bit, but I recognize my good friend from Connecticut, the ranking member.